Dignity Health Cancer Institute at St. Joe Hospital and Medical Center offers a comprehensive approach to diagnosing and treating cancer. And joining us today is Dr. T and Dr. Thawani. I'm talking about a cancer I'm not very familiar with. And Dr. Thawani and Dr. T, let's first give a little background about the two of you. Let's introduce everyone to you. So what type of doctors are you?
So I'm an associate professor at Dignity Health Cancer Institute. I specialize in treating cancers of the thoracic and abdominal region with radiation.
So, and Dr.
Hey, hello, good morning. Vamsee Torri here, medical oncology at Dignity Health Cancer Institute, St. Joseph's. I treat abdominal tumors.
And the cancer I'm talking to you about today is something I didn't know too much about, but it's with the esophagus. And there's a name here that I know we both were talking about this name. It's very interesting. And Dr. T, let's talk about this type of cancer and what's it called?
So it's a esophageal cancer. So it's a cancer of the esophagus, which is the food pipe connecting the back of the throat to the stomach. So there are different types of esophageal cancers. We call it a squamous cell carcinoma. That's nothing but the lining of the skin and also the lining of the hollow organs.
Yeah. And let's talk about the symptoms of this, because it's very interesting that probably someone at home right now is sitting and maybe having these symptoms and thinking that it may be just heartburn, right?
The commonest symptoms depends upon how the cancer stage is, right? So most commonly we see along the throat, so difficulty swallowing, pain on swallowing, or acid reflux symptoms, as you mentioned, which is long-standing and getting worse, sometimes nausea and vomiting too, and pain.
Yeah. And what about drinking hot stuffs? I mean, you hear about, like, you want to be careful drinking hot stuff because the esophagus is going down. Does that cause cancer too?
So it's any hot beverage. So there are some studies which have shown that associated with tea, and that too it's more than 150 degrees. So it's similar like you drinking a very hot beverage and you're burning your mouth. And that's what's happening back on your food pipe.
Wow.
So if it keeps on happening, and if repeated injury happens, that may increase the risk of cancer. So generally I recommend to drink warm to hot, not more than 150 degrees temperature over a period of 5 to 10 minutes. So.
Dr. T, let's talk about, of course, treatment for this, which is very important, and this is where Dignity Health comes in, because they know that every patient's different. But there's 3 different ways of treating this, am I right?
Yeah, it really depends on what stage the cancer is when it is diagnosed. We decide, there are 3 types of treatment. We can do surgery, radiation therapy, and chemotherapy, and now the newest treatment is immunotherapy. And we use different combinations of these treatments for depending on the stage of the patient, also depending on what the goals of life for that patient is, what their quality of life intent is. So depending on the stage, if it's really early stage cancer, surgery alone can be curative. If it is further advanced, we can use chemotherapy and radiation to shrink it and then go on to surgery. And if it is further advanced, we can use either chemotherapy or immunotherapy, which Dr. Torri specializes in, and use radiation to shrink it. Even radiation can be different kinds. It can be done from outside. It can be done from inside out as well.
Yeah. Okay, you said about radiation, then of course, Dr. Torri, you do a different type, and let's explain a little about that, because everybody knows about the radiation, of course, shrinking it and that, but your type of treatment.
So I do medications in treatment of cancer. So we have main 3 types. A lot of people have heard as chemotherapy. So we have other 2 types, like a targeted therapy and immunotherapy. So I always say chemotherapy is like a shotgun approach. You're trying to get the cancer cell, it may hit or not. And a targeted therapy is more like a sniper rifle, trying to really hone on to the cancer cell. The third one, especially in the last year or so, we have FDA drug approved for immunotherapy. The cancer is kind of outsmarting the immune system. We are trying to reset that.
Yeah.
So that way the immune system can identify the cancer and kill it.
So, and what's so great about Dignity Health Cancer Institute is that you all work together. You have your special field, you have your special field, and other special fields, but coming together with the patients on the different, of course, levels they are, you all help for, of course, the best for them.
Yeah, this is one of those diseases where multidisciplinary care is of utmost importance. So we all need to put our brains together, put the special nuances of that individual person and their individual cancer together to tailor a program that is specifically for that patient. And so we we have tumor boards where we'll sit together. We have radiologists, pathologists, nutrition, genetic experts, genetic counselors, social workers, and the entire system that actually comes together for each individual patient and will tailor the care specifically to that patient.
Yeah, I'll tell you, it's amazing and so wonderful that we're learning more and more about these different cancers that can be treatable, that can be preventable too, of course, by going to Dignity Health Institute's website and find out more, of course. And so I thank you all very much for joining us. So thank you too.
Thank you for having us.
Yeah,
Thank you.
Thank you.
And of course, you can go to aztv.com. We'll have more information on, of course, Dignity Health Cancer Institute at St. Joe Hospital and Medical Center, where you can get all the information if you are looking to, of course, talk with the doctors about treatment and also signs that you might have with cancer. So, all right. Thank you. We'll be back with more in just a little bit.